Hi, welcome to our podcast. My name is Alejandro Freire. I'm the director of Fair Dental Clinic here in Costa Rica. Today, I'm super excited about this podcast because actually we have a very special patient that she arrived to our office 13 years ago when we just was starting, as an office, and everything of this medical tourism was a dream for me. And now I'm super happy to say that she's my patient, but also my friend, Jean Lebec. How are you, Jean?
I'm good. Glad to be here.
It's a pleasure. Who is Jean Lebec? Let's start first. I know many patients that already know everything about us, but hey, let's talk a little about you, okay?
Okay. From Brooklyn, New York. A grandmother.
Nice.
A performer. I'm a storyteller. I'm a retired teacher and a retired principal. And that's about me.
Wonderful. Look, guys, Jean Lebec arrived to our office many years ago, presuming the dream of having a new smile with a full dental implant restoration. But always, the idea of this podcast is that actually you can feel related with her in a way that why did she choose Costa Rica? Why for dental? How was the experience for her? So my first question will be, why Costa Rica? There are so many options. In your case, first, of course, United States, but then there are options like Mexico, Turkey, or so many countries that offer medical tourism. Why Costa Rica was your option?
Okay. So when I realized I would need dentures, it was probably one of the most devastating moments for me because the idea of, I felt that I was kind of young at the time, but the idea of having my teeth out, and I used to see my mother, she had dentures, and it really scared me. So when that became a reality, I began, and when I also realized that the procedure I was looking at was hardly being done in New York. There was one clinic in New Jersey,
Right.
and who had studied under Paul Mallow, who did this.
Mhm.
And when I went and found out I was a patient, the cost was just astronomical. It was not even within anything I could do.
And this is important, because we need to remember Jean was a patient from us 15, 13 years ago.
Yeah.
This technology of all-on-4 immediate loading was just starting. It was just a field for very little specialists. So, of course, prices are high now. Imagine 30,
Yeah.
13 years ago,
Yeah. And so I began to research, and all of a sudden, your name popped up with Dr. Sains as having studied this procedure. And that in nowhere else did they talk about actually studying the procedure because it was so new.
Yeah.
So I thought, oh, this is it, and everything you said in any of the work I read aligned exactly with what this procedure was about. Whereas other doctors that I read, it wasn't the country, it was the doctor, it was you.
Basic, okay.
Okay.
Did you knew anything about Costa Rica, or what are your feelings from Costa Rica nowadays? What do you feel about this country?
Well, first of all, I've never met such warm, wonderful people. I don't know Spanish, and I get myself around because everyone helps me. All I have to do is go, I speak English, and everyone is right there. When I had to go 2 days without teeth this past week, I'm like, how do I say mashed potatoes? And everybody that I worked with, they just were right there helping me. So
that is super important for us. I always emphasize that it's not only the dental procedure, it's the full concierge service, it's the whole experience.
Yes.
You're coming to another country. Sometimes patients arrive, like in your case this time that you came alone.
Yeah.
And they need to feel, that they have persons going and working for them and helping you in every single aspect. And I feel that is super important. And thank you for emphasizing that.
Well, it's everything. And even though, compared to even 13 years ago, when I met with you and Dr. Sains, you were just, you heard me because first we have shame. Those of us with bad teeth have shame. Either we didn't brush well enough or we ate whatever our parents told us, we felt responsible. And, when you feel shame, you stay away from the dentist instead of going. When I met with you and Dr. Sains, you didn't make me feel that way. You made me feel like, okay, work with us, we're going to work with you. Nice. And I felt, I don't know if you remember that I, at one point, was just crying and crying and talking about teeth, and Dr. Sains kept giving me tissues.
Yeah. Look, is that, it's a big responsibility for us, because many patients that they come for full mouth reconstruction with implants, they're coming for their biggest dental treatment of their life,
Right.
and they're trusting in us, and we need to give a good quality treatment in short time and keep the expectations. So, that is part of our work, and it's amazing how the patients do the research to actually see. Sometimes it's not even the country, it's the doctor, or
Yeah.
the doctor can offer what actually the patient is looking for.
Yeah.
So for us, having always the technology that we are able to put the implants, but also give you a set of teeth immediately, is to try to avoid to the patients that issue that you just said. That I remember my mother taking out the
Yes.
dentures.
Oh.
There is a thing that with dental implants, all-on-4, all-on-6, immediate loading, you try to avoid that to the patient as much as possible, to try to take out that. Now, what do the people around you told you when you were telling them, I'm going to Costa Rica for a dental procedure? Your
They-
family members, your friends.
They thought I was crazy. They really did. And then they gave me every reason why, you'll come home, something will go wrong. What are you going to do? You're going to fly back. Everything that could go wrong, they were telling me was going to go wrong. But for me, there was no choice. I knew I had to go and do this. I mean, the fear of having dentures. And, that's the thing. It wasn't really being done in New York, even though that clinic was doing it, but it was unheard of, even that. No one could even understand what I was doing. You're having your teeth screwed in your mouth, they didn't even.
And you had that in the moment that you had your new set of teeth 13 years ago. What was the biggest changes in function, aesthetic, self-esteem? What does this treatment brought to your life,
Well, it's your life. It's every single aspect of your life. And as a performer, even though I know people can't see my teeth from an audience, but going on a stage with teeth you're confident in, where when photographs are taken, you don't mind smiling. You're not, had this weird way of smiling in pictures, and suddenly you're not doing that anymore. And who you are is coming out in every aspect of your life, even as being within my family, feeling good, being with kids, they're not looking at your teeth and going,
Wonderful.
Yeah.
Now, tell me, how was for you the maintenance for all these years? Because, for me, it's wonderful to have a patient that we treat so many years ago, when we were a totally different clinic, when we were starting, when actually Massimo, that was the guy that makes me concierge service, he was the guy that he helped her to bring medications. I only have one dental assistant. I was my dentist plus
you were everything. You were everything.
Dental technician, man. But full of dreams, and now the dream has become a reality, thank God. But how was for you the maintenance in these years? What do doctors tell you in the States? How do you clean it? What do they tell you about the treatment, the quality of the treatment when they see it?
Well, I think that I was really lucky. So I researched again, doctors in New York. Now it's coming back. And I found a woman who was doing reconstruction, and I said to her, I had this done in Costa Rica. I was very honest, and I said, but I need upkeep. I need cleaning. Would you be willing to do this, even though? So, and she was like, of course. So for all these years, I was going to her for my mouth to be cleaned every 3 months, which
Wonderful.
was, and water pick, and just keeping your mouth clean, just being more diligent.
And this is super important. Patients, I don't know why, but they make the mistake that they feel that when they have dental implants, they need to forget about dentists.
I know, like they don't.
I have dental implants, I will never have cavities. I forget about dentists. And no, it's like a new beginning for you. You need to be clear that you need to make maintenance. Well, hopefully all the patients will be like, Gene, every 3 months is, it's a dream for me, but at least once a year, go take out the prosthesis, clean everything, because that is what is going to give you a nice result so many years later without any bone loss, without any infections, with the prosthesis working. Because look, 13 years ago, that technology that we had was a metal bar structure with acrylic teeth. And the latest technology for me was to be able to do that in 3 days, That was the thing, give to the patient the set of teeth immediately so the patient doesn't pass using a removable denture. That was the adventure, give to the patients the immediate loading. But the technology of the teeth still was a little archaic, it was acrylic teeth. But if the patient have good hygiene, a normal diet, if the patient take care, look, the restoration will be perfect 13 years later. And that makes me another important thing. You have been with this, well, when do you start thinking about zirconia? When do you hear about all this new technology?
Okay, here's what happened. So I got nothing but compliments for my teeth. Acrylic, no one knew. If I said to someone, these are acrylic, they would not know what I was talking about. That what happened was, it was right after COVID.
All right.
And I was pushed forward by some teenagers. They didn't mean it. They were throwing backpacks in, but I got caught up in it, and I cracked a front tooth.
Okay.
And went into a panic.
Of course.
So I went to luckily I had someone who was cleaning my teeth, and she came in, and as she was fixing it, she said, it would be really a good idea for you to think down the road of switching from acrylic to zirconium. Am I saying you're right? So she was the first person that brought that to me. But I knew that even if I was going to do it, I wouldn't be going to her. Not about the money, but I would only go to you. Because I knew you knew my implants, you knew what you did. You could look at the x-ray and know it.
Perfect.
One of the things she said to me was she thought it was an incredible job. And the hygienist who looked, goes, you know what, Jean, you have bone growth.
Yeah.
She said, look at all this. And she pointed, they thought your implants were excellent. And that was the work, to keep my teeth clean, to keep that. And they said, you're going to be fine if we just,
But for you to know, this is not only the doctor's work. I always tell to my patients in an honest way, this is a 50-50. For us, we need to give you a nice implant brand and use the latest techniques for the implant surgery. But if the patient doesn't make maintenance, if the patient controls smoking, if the patient, I don't know, he's diabetic, but he controls the diabetes, all those factors will help an implant to maintain through the years. So the doctor tells you about zirconia, and you start thinking about, and at the end, you give us the blessing of last week to arrive to Costa Rica for this new beautiful smile. Well, the first thing I want to ask you, what was the changes that you've seen in our office 13 years later from the first beginning that we had,
Okay, so first, my biggest fear, as soon as I knew, and Massimo could tell you, I've been talking to him for a year.
I know.
He's been pushing me. But the first thing was, can I do this alone? And that's where you're, Massimo was going, yes, you can. We'll do this. And we do. And before I knew it, I had my appointment at the hotel, and Olga was going to meet me. And just that alone, you get off the plane, you're kind of dropped into okay, and my journey is beginning, and what's going to happen? And so there was Olga, and then there's Andrea, and there were just so many wonderful people, everybody in the office. And the office,
from that little first chair that we had only, right?
And we did my surgery in Hospital Católica.
Yeah, in Hospital Católica,
So you didn't even have.
No, we didn't have the surgery rooms in that moment, yeah.
So when I came in with Andrea, it was like, oh my God. Yeah. And the whole floor and everybody. But one of the things that I feel very secure about is knowing that everyone's been trained by you or working with you, so that even if you're not directly working with me, I felt completely confident with everybody that did.
Yeah, that's super important for me, to have a whole team that I guarantee you that all of them are specialists,
Yeah.
that we have the same protocol,
Yeah.
and that no matter what, the quality of the treatment will be the same. And actually, that's important, because
Yes.
you leave the part that in that moment I was the one that did everything,
Everything.
And now in this part, you see a whole team working for you, and that you feel that, the same quality and human sense of all the doctors are
Well-
fine. That gives me a lot of peace and
Yes.
happiness that, we are
Every
giving
person
good
that I
treatments.
And I knew you were there, so you were coming in
Yeah, well,
and out.
because it was you, of course, I will go be checking a lot to see how was everything going perfect.
But everything was. And I think the biggest compliment you've gotten as a doctor from New York is the implants themselves. They called people in to look at my X-ray,
Nice.
and I was very, very pleased by that. Which she was like, "This is amazing." I think what both the hygienist and the doctor felt so good about was the amount of bone growth that that's denser. They could
Perfect.
see it.
Now, let's talk about this new technology at zirconia. Nowadays, you have, in this moment, the best dental option over dental implants. That is a titanium metal bar frame, and over that, you have a full arch, full zirconia, using the technology of photogrammetry that ensures that the level of precision of adjustment of the prosthesis to the implants and to the gum tissue is amazing. What do you feel now? How do you feel now with the new zirconias? What are the difference comparing to acrylic?
If anybody, first of all, I thought the difference was going to be more cosmetic. I didn't know it was going to be so physical. And so I told you that really last night coming home and just, because they were just put in yesterday. So it's like,
Yes.
coming home with my new teeth. But but just kind of sitting with them and feeling it, I started crying because it was the first time I felt that as close to my real teeth, what real teeth must feel like.
Yeah.
Because the acrylic's very bulky.
It's bulky.
And I didn't know that, because I had nothing to compare it to.
Exactly.
So when people say you should make the change, I kept thinking cosmetically. My speech is even better. I could hear myself.
Of course, you have more space now.
Yeah.
Is that, I would be honest, is that the strength of the material. Zirconia, like is a so strong material, give us the option to make thinner the restoration without losing strength. Actually, zirconia teeth are more strong than acrylic. In acrylic, for they not to break, we need to make the metal bar frame and then give a lot of thickness to that acrylic so it doesn't break,
And
because
yeah.
acrylic was designed for removable dentures. And in a removable denture, you will never eat something hard, because if you eat something hard, the prosthesis will have micro movement because there's nothing attached to it.
Right.
In the moment that you use it to implants, the prosthesis is attached to the implant, the patient bites hard, and something needs to
Right.
to resist, and that will be always the
Yeah.
acrylic, And with zirconia, that will not happen.
It's I can't, words really, it's hard to describe, especially when you don't have teeth, and with the acrylic, you don't have teeth. I still know I don't have teeth, but it feels like I have teeth. Like I could feel them.
No, and we are super happy and honored that you choose us as your office. And yeah, I don't know, just thank you. For me, it's a blessing and an honor to have you in this podcast. In a true way, you were one of our first patients many years ago, and having not only you, so many patients that are satisfied that they, in an organic way, they send us reviews, that they talk to other patients, that you in this case, that you just tell me, Doc, if you want to do the podcast, let's do it. I just want to go and tell my story. Really, really, it's an honor, and thank you.
Well,
and thank you for trusting in us, and hopefully you will have a wonderful smile for many, many years. And
I'll come back to you if I don't.
Of course, and for dental is your house, okay?
Okay.
So, Jean, thank you for everything.
Thank you, Dr. Freire.
Have a nice day, okay? And everything. And a nice life and a new set of teeth, okay?
Okay.
Bye.
Bye.